Hi, my name's Danielle. I'm a nurse practitioner student at Franklin University. I'm going to talk about hypertension today and why it's called the silent killer. First, I want to talk about hypertension. I want to define it. Honestly, hypertension is really just a fancy word for high blood pressure, and it's much more common than you think. Do you ever wonder why blood pressure is so important? Every time we go to the doctor or see a healthcare provider, our blood pressure is checked. A blood pressure is considered a vital measurement, and vitals are important. Particularly uncontrolled high blood pressure is considered the silent killer. And we're going to talk about the importance, and we're going to start with the basics. I work in the emergency department, and I'm constantly getting asked, is this high blood pressure? What's a good blood pressure? The definition of hypertension or high blood pressure is that top number, which is your systolic, being greater than 130, or that bottom number being greater than 80, which is your diastolic number. So what exactly does that mean? High blood pressure is defined as anything greater than 130 over 80, with one or both of those numbers being greater than the number. All right, so this condition ranks among the most common medical conditions. Uncontrolled high blood pressure contributes to stroke, heart failure, heart attack, and even renal failure. High blood pressure is common and treatable, and it's the second leading cause of death due to preventable disease. Can you guess what the leading cause of death is to preventable disease? Smoking cigarettes. High blood pressure is only second behind smoking cigarettes. High blood pressure often goes unnoticed and untreated because it doesn't really cause any symptoms unless it's extremely low or extremely high. Unfortunately, while the blood pressure is high, it continues to cause what we call silent organ damage. This is because the condition goes unnoticed, but our organs continue to suffer. High blood pressure causes the vessels in our body to become smaller, which causes our heart to have to work harder to pump the blood throughout our body. And it's very dangerous. If you don't take care of it, it can cause major issues, and it's tricky because it doesn't typically cause symptoms. That's why we call it the silent killer. So what does that mean? And I ask, what does blood pressure truly mean? If you search the definition, it's defined as the force exerted on the walls of the blood vessels, specifically the arteries as your heart pumps blood throughout your body. Too much pressure over a long period of time can damage those arteries, and then damaged arteries leads to those conditions we talked about earlier, such as heart problems, stroke, and kidney issues. So ultimately, you want to control your blood pressure because that decreases your risk of developing other issues throughout your body. So how do we find that balance? The goal of blood pressure is for it to not be too high, but also not too low. Low blood pressure, on the other hand, can cause a lack of oxygen to our tissues and organs, where high blood pressure causes that permanent damage that we were talking about to the vessels, or basically the pipes throughout our body. However, most people tend to have issues with high blood pressure, and honestly, it's really tricky to find that balance. Risk factors to high blood pressure include increased age, genetics, being overweight, lack of physical activity, a high salt diet, and high alcohol consumption. Fortunately, there are ways to reduce high blood pressure, which include things like reducing your salt intake, increasing your physical activity, maintaining a healthy weight, and refraining from tobacco use and not smoking. Healthcare professionals need to continue to educate individuals as certain groups that are higher risk of developing uncontrolled high blood pressure. People that are at a higher risk include geriatric individuals, so as you get older, it's harder to control the blood pressure, males, Native Hawaiian and Pacific Islanders, and African Americans. We can't change certain factors like our age and our genetics, but we do have control over our habits, such as reducing the risk factors by maintaining a healthy weight, increasing our physical activity, eating a low salt diet, refraining from excessive alcohol consumption. So those are some of the things that you can work towards to reducing your risk of having high blood pressure. So there's actually a really strong link between lack of education regarding blood pressure and management and uncontrolled high blood pressure, which basically just means that people can understand the risks, then they are more likely to take the medication that they're prescribed. You can't really fix something that you know nothing about. So compliance is huge, and compliance means that you're diagnosed with high blood pressure, prescribed medication to treat it, and you're continuing to take those medications as directed. Taking medications is extremely important, just even outside of high blood pressure medications. So you always want to ask your provider any questions regarding the medication and continue to advocate for yourself. You never truly have to do anything they suggest, but obviously it's very important to understand the risks and the benefits. So honestly, it's a little tricky. Don't have high blood pressure, but also don't have low blood pressure. It's important to find that balance, and it can be really confusing, which is why ultimately these conditions and medications need to be closely managed by a healthcare professional. Managing your blood pressure and your risk factors can help you live a long and healthy life, so why not? Now that you know, you have the tools to seek help, ask questions, advocate for your own medical care, and work towards managing high blood pressure.